So recently, I've been thinking about how I can increase audience retention and make people want to watch a little longer. And I thought if I do something silly in the beginning of each video, maybe people will want to stick around a little longer. So today, I'm going to balance this pen on my finger. Never mind. Okay, so departure from whatever that was, today we'll be talking about some of the top tips that I've learned when it comes to treating depression after being in the field for, multiple years now. What are some of the strategies that I found most helpful for supporting people with depression? If you don't know me, hi, my name is Dr. Parky Lau. I'm a clinical psychologist licensed in the state of California. I earned my PhD in 2024 and then completed a postdoctoral fellowship at Stanford University. And I'm here because I love talking about mental health and providing you with tools that you can use for your everyday well-being. So Dr. Aaron Beck, who's kind of the founder of cognitive behavioral therapy, believed that depression resulted from these sort of core ways that we viewed ourselves or others or the world or the future, and specifically towards ourselves, that he believed that there were certain ways that we would think about ourselves, like either as unlovable or worthless or ineffective, that made it hard for us to break out of the depression cycle. And this core belief of ineffectiveness in particular, I think really contributes to sense of hopelessness about the world and about ourselves because it kind of basically suggests that nothing that we do can change how we feel. And this belief of ineffectiveness really results from sort of past experiences where any actions we engage in are never reinforced. Like there was never a good consequence associated with the action. So at some point, we just believe nothing good will ever happen regardless of what I do. And this leads to something called learned helplessness, which is a model of depression, which was studied by Dr. Martin Seligman, where he basically had these dogs put in a cage and he would continuously deliver a small electric shock to these dogs. And no matter what the dogs did, whether they jumped, whether they barked, whether they tried to like scratch their way out, they would continue to receive these shocks. So eventually the dogs would end up in a rather passive state because they had learned that there was nothing that they could do to really change their environment. So why bother? And the crazy thing was, even when Seligman changed the conditions of the environment, that the door became unlocked and the dog could escape, the dog continued to do nothing because it had learned that nothing I do will change what's going to happen to me. So why bother? And that was sort of the model of depression through learned helplessness. So in order to break past this sort of learned experience, we need to make sure that the actions we engage in actually make us start to believe that what we do has an impact on our success, has an impact on our likelihood of a positive outcome. So this leads us to tip number one, which is identify your goal and then ask yourself the question, are my behaviors in this moment most likely to get me towards that goal? Like for example, if my goal is to become fit, is my behavior in this moment, which is maybe eating chips or not going to the gym, likely to get me towards that goal of being fit? And the answer, of course, in this case, obviously, is no. That's not the behavior that's going to be helpful to, get me towards that goal. Or if my goal is to have a really nice, romantic relationship, is my behavior of like keeping secrets or not buying that person flowers or going on dates with them, is that consistent with my overall goal? In this case, again, no, like it's not consistent towards that goal. So you want to first of all identify what is my desired outcome, what is my goal, and then say and illustrate what are the behaviors most likely to get me towards that goal. So along that line of achieving our goals, we want to make sure that we recognize that when we're struggling with depression and we're not motivated, we feel a little bit hopeless, we don't have a lot of energy, it's going to be very, very hard. So one thing that's going to be important is for you to set something called SMART goals, which stand for specific, measurable, achievable, relevant, and time bound. So you want to make sure what you're setting in terms of behaviors are something that you are likely to succeed at. So, if you're wanting to be more active, going for a marathon every single day probably isn't going to be the best approach for you, especially if you haven't ran for, a long, long time. So you want to say maybe start with something more specific and small. Like for example, maybe I'll just do a 5-minute walk or a 10-minute jog around my park, whatever that is for you, to make sure that it's something that is relevant to your goals, but also specific and achievable in the sense that you're likely to be able to do it and follow through. As you might imagine, with more active therapies like cognitive behavioral therapy, a lot of the work is not actually done in the session. It's actually done in between the session. It's kind of like having a physical trainer. Like, you don't expect to have all your gains made in that one 30-minute session with your trainer. It's actually going to be a lot of the muscles going to be built in between the sessions when you're working out. So you want to make sure that what you do set in terms of goals are first smart goals. And also, tip number three, addressing any obstacles that may get in the way of you doing the thing. Like, for example, you might think, well, okay, I want to be more social, so I'm going to talk to three people every single day. So, what could get in the way of me doing that? Well, maybe I might feel really not motivated to get out, out of the house. So, maybe I need to plan for a specific time that I'm getting out of the house and plan for specific people I'm going to talk to. Maybe it'll be the cashier, and maybe it'll be the receptionist, it'll be my bus driver, Uber driver, whoever that might be for you, to be able to think about what are the things that could get in the way and problem solve so that you're setting yourself up for success and not falling into the trap of setting a goal, failing to achieve it, and then feeling even worse, and in some ways, like beating your depression as a result. Now, tip number four is more related to what activities you should choose in the first place, which is to identify important values to you. So, what are the things that are most important in your life? Whether that's family or relationships or creativity or freedom, identify what are my values. Because when it comes to depression, one of the things that is probably a big contributor of depression is that people follow what they think other people metrics of success are, and they stop thinking about what makes me happy. And this is why you have a lot of people end up in their 30s or 40s feeling like, why am I not happy even though I have this high paying job, I've done everything I should be or I should have accomplished at my age, but I feel really empty. And it's because they might not have asked the question, what is important to me, not just society? So figure out what are your values and then engage in the behaviors, the smart goals associated with that value. So if your value is relationships, then maybe calling your mom, spending some more time with your family, spending more time with loved ones. Those are going to be the behaviors that are more likely to actually contribute to your overall well-being. So of course, alongside the behaviors in cognitive behavioral therapy, you also have the cognition, the thoughts. And many of you who have struggled with depression probably have heard of like cognitive therapy or cognitive behavioral therapy and try changing their thoughts. And for some people, it might work really, really well. And if so, keep doing that. And some other people might think, well, it's kind of gaslighty. It's trying to make me believe something I don't really believe, and it's not a good experience. And for you, I have a specific tip for you, which is number five, focus on utility rather than validity of thoughts. And the reason I say that is that some thoughts may be true, we don't know, but certainly it's not helpful. Like if I have a thought, nothing is going to help anyway, or I am a loser, what's the point? Those thoughts, we don't have to bother with the validity because I'm sure you might come up with 50 different reasons why you don't feel good or why it's hopeless. At the same time, you can then ask the question, is this thought helpful? Like, is it helpful for me to have the thought nothing is going to work anyway? Probably not, because then you're just going to continue to feel depressed, not try anything new, and not give anything a shot for the possible chance that you might feel better. So, in this case, don't ask the question, is the thought true, and try to challenge that, but rather ask the question, is my thought right now helpful? And if not, you can engage in actions in spite of what you're thinking. And tip number six is to actually also at the same time give yourself some self compassion. Because oftentimes when we're struggling with depression, we are not very motivated, we feel horrible, we feel like blah, we feel empty, and even doing the smallest thing can feel like climbing the highest mountain. The one thing that is helpful, especially for the people who blame themselves for feeling, so terrible, like I'm just a bad person or a bad partner or a bad son or daughter or whatever, all of those guilt and shame just adds an extra layer of depression and seeks to reduce our energy stores even more. And the sort of action urge associated with shame and guilt is usually to kind of like move away and disappear. And those aren't going to be super helpful for you. So, one thing that can be helpful, of course, is to actually offer yourself some self compassion. And one strategy I find really helpful for that is something called the best friend technique. Like, if this was your best friend or someone you really cared about in the same situation, what would you say to that person? And you can imagine that you're probably a little bit more compassionate than you would be if you were talking to yourself. So try to imagine yourself over there, and that's your best friend. You are your best friend. What would you say to them? So a lot of these cognitive and behavioral strategies can be really, really helpful for depression. But in some cases, when depression is particularly severe, it's hard to kind of just take this and run with it. And you might need tip number 7 to kind of speak with your medical provider about the possibility of medication. Because there is some research to suggest that, especially for more severe cases of depression, it's helpful to have a little bit of both that sort of combination therapy of medication as well as therapy to really make sure that you're getting the best of both worlds so that the medication helps to kind of ease off the pain just a little bit to give you that space to try out some of these skills. So hopefully you found this video helpful. If you're interested in learning more about some of the sort of daily habits that we engage in that can actually contribute to depression and how to deal with them, I'll throw up the video somewhere here. Otherwise, thanks for watching as always, and I'll see you in the next one. Bye-bye.